Pandemic. We already have 165 participants for today. Thank you guys for making time and visiting our webinar. My name is Rachel Andela Serna, and I am the Vice President of the FEU's Medical Technology Society, and I am your moderator for today. Now, I would like to ask you one question to check if you can see and hear as well. My question is, under what course or subject is our chosen topic for today? You can input your answers through our chat box. That's right, Cheska. It's hematology. Great. So, before we get started, let me explain how you can talk to us during the webinar. You will have the opportunity to submit text questions to today's presenter by typing your questions into the chat box. There, you may send in your questions at any time during the presentation, as we will collect these and address them during the Q&A session after today's presentation. Take note that we are also live on the MTSOC, IS, and FEU's official Facebook accounts, so you can invite your friends and blockmates to come watch and be a part of our webinar. Of course, we will send you all the relevant links after the event, including an evaluation form for the distribution of your e-certificate of attendance, because only those who have pre-registered and completed the webinar will be issued a certificate. Okay? Now, first, let me introduce to you one of our assistant program heads and clinical coordinator of the Department of Medical Technology, Albert Benny C. Deloiras, to give us a short introduction about our topic today.
Good afternoon. Can you hear me?
Yes, sir.
Okay, thank you. So good day, everyone. Today, we welcome you to the first Department of Medical Technology webinar created under the Institute of Arts and Sciences Virtual Activity for Supporting Education, or IS-VASE program. For this session, we will talk about anemia in the time of COVID-19 pandemic. Anemia is still considered as a global public health problem affecting children and adults. Increase in micronutrient malnutrition during this time of economic crisis is expected due to several affected programs and limited availability of food for proper nutrition. This webinar aims to shed light to this issue, so let's sit back, relax, and have a meaningful afternoon. Thank you.
Thank you for that, Mr. Deloiras. And now, I would like to present to you the Dean of the Institute of Arts and Sciences, Dr. Rowena Capullo Reyes, to give us her opening remarks.
Hello, Rachel. Can you hear me?
Yes, Dean.
Mark Isla, Associate Dean of the Institute of Arts and Sciences, Francisco Galecanao, Department Chair of the Medical Technology, Albert Benny Dolaires, Assistant Chair, Laarni Lacorte, Assistant Chair, Medical Dr. Paula Biancanucci, our resource speaker, and of course, Rachel de la Serna, our moderator, and our dear students. Good afternoon, everyone. Welcome to the maiden webinar of the Department of Medical Technology. I am particularly proud of this webinar because I know the organizers are quite busy with the number of students to manage and the AUN preparation. But hooray, here they are. Congratulations. We are now in the first IS-VASE, yes, Virtual Activity Supporting Education, entitled Anemia, Diagnosis and Prevention and the Impact of COVID-19 Pandemic. I always say that an IS student is inquisitive, altruistic, and scientific. The topic to be presented by our dear speaker will help us look at the pandemic in a scientific way. The World Health Organization survey, which was completed by 155 countries during a 3-week period in May, confirmed that the impact is global and that low-income countries are most affected. As mentioned by Benny Dolaires earlier, the World Health Organization's at the Micronutrient Forum also revealed that the COVID-19 crisis resulted in an increase in nutrient malnutrition, including anemia due to the disruption of health services and food system, on top of what we're feeling now, an economic crisis. Hearing this is very disturbing. And so we ask, we are in the academy. What can we do? Perhaps we'll start with discussion. And the discussion, diagnosis, and prevention will help us understand anemia in the local context. Please listen with understanding so we can help combat the ill effects of COVID-19. I acknowledge the hard work of everyone who made this webinar happen. First Chair Galecanao, Assistant Chairs Dolores and Lacorte. Thank you to our speaker and medical technology faculty, Dr. Nuki, our lovely and very eloquent moderator, Rachel, and our very supportive Christian Evasco of MCO. Again, thank you to everyone who made today happen, faculty and students. Magandang hapon.
Thank you, Dean Reyes. Now, I see what we already have 222 participants for today. And now we can begin. As our department chair, Francisco Galecanao, introduces our speaker for today. Hello, sir.
Hello, Rachel. Can you hear me?
Yes po, yes, sir.
Okay, thank you. Good afternoon, everyone. I have the privilege to introduce to you our speaker for this afternoon. Our speaker is a registered medical technologist and a licensed physician, a graduate of Bachelor of Science in Medical Technology and a Doctor of Medicine from University of Santo Tomas. She finished her pediatric residency and pediatric hematology oncology fellowship from UST Hospital. She is a Harold Ganson Fellowship awardee, Regional Congress of the International Society of Blood Transfusion, Bangkok, Thailand in November 2019. A recipient of Department of Medical Education and Research grant on her oral research presentation entitled Chemotherapy-Induced Leukoencephalopathy, presented at the 37th World Congress of Hematology in Vancouver, British Columbia, Canada at the Vancouver Convention Center, September 2018. Her research, Subcutaneous Panniculitic T-cell lymphoma in an adolescent, a case report, was published in Advances in Hematology and Oncology Research in February of 2020. A diplomat of the Philippine Pediatric Society, a pediatric consultant at De Los Santos Medical Center in Quezon City, and our very own faculty at the Department of Medical Technology. Ladies and gentlemen, please welcome Dr. Paula Bianca E. Nuki.
Good afternoon, everyone. Can you hear me?
Yes, Doc.
Okay. I would like to thank everyone for the warm invitation. Thank you to the Far Eastern University Institute of Arts and Sciences and to the Department of Medical Technology, Dean Rowena Capullo Reyes, Sir Francisco Galecanao, and thank you for giving this opportunity to share my knowledge in the field of hematology. Okay. So I have no conflict of interest, and I'm an active consultant currently in the De Los Santos Medical Center and a faculty of the department. So we will be going through the basics in the study of red blood cells, anemia with its classifications, investigations, and preventive measures, and the impact of the COVID-19 pandemic. Anemia affects both children and adults of both genders, although pregnant women and adolescent girls are most susceptible and most affected by this disease. Do you know that the WHO estimates that 42% of children less than 5 years of age and 40% of pregnant women worldwide are anemic? The graph shows that for pregnant women, specifically in the Asia Pacific, around 35% are affected, and through the years, even before the pandemic, there is failure to address this disease. The WHO defines anemia as a condition in which the number of red blood cells or the hemoglobin concentration within them is lower than normal. So, shall we learn about red blood cells? RBC production is called erythropoiesis, and it is the process whereby a fraction of primitive multipotent hematopoietic stem cells becomes committed to the red cell lineage. This involves a highly specialized functional differentiation and gene expression. The entire process takes typically around 5 days. Mature red blood cells are flexible bicube discs, and they are like a donut without the hole, and it does not contain any nuclei. Around 2.4 million new erythrocytes are produced per second, and they measure approximately 6.5 to 8.5 micrometers in diameter. These cells are able to pass through the capillaries, and its thin membrane aids in gas exchange of oxygen and carbon dioxide in the lungs. The average lifespan of RBCs is 120 days, and the hemoglobin is needed to carry the oxygen. Anemia occurs when there are too few or abnormal red cells or have not enough hemoglobin, resulting to a decreased capacity of the blood to carry oxygen to the body's tissues. This results in symptoms such as fatigue, weakness, dizziness, shortness of breath, and among others. For the pathophysiology, because of the decrease in the red blood cell count, hemoglobin and hematocrit level, this will diminish the oxygen carrying capacity of the blood, leading to hypoxia and end organ production of signs and symptoms. One of the most common signs of anemia is fatigue or weakness, and another is pallor or anemic eyes due to the decrease in the level of RBCs. Koilonychia, also known as spoon nail, refers to abnormally thin nails which have lost its convexity, becoming flat or even concave in shape. Papillary atrophy of the tongue is another sign showing affectation of the normal papillary development. Also, angular stomatitis can develop in nutritional deficiencies as well as dysphagia and glossitis. Aside from brittle nails, we also have brittle hair as one of the signs and symptoms. So we go now with the different classifications of anemia. But before that, in order to confirm anemia, we should first know the normal values. So the level of hemoglobin differ with age, and in the adult female, the normal value is 14 grams per DL, while the male has 15.5 grams per deciliter. I think that not only as healthcare professionals and as hematologists or allied health professionals, we need to know or made aware about this normal values because we should take note that it is part of routine checkup to know if we are within the normal range of the results. Another way of measuring red blood cells is also knowing and investigating the red blood cell indices. MCV or mean corpuscular volume is the measure of the average RBC size, and the normal value is 80 to 99 femtoliters. The formula of this is 10 times the hematocrit over the red blood cell count. Another index is the mean corpuscular hemoglobin concentration, which is the measure of the concentration of hemoglobin in a given volume of packed red blood cells. The normal value is 32 to 36 grams per DL, and the formula is hemoglobin over the hematocrit. The last index is the average mass of hemoglobin per red blood cell, and the normal value is 27 to 31. So what is the significance of knowing the different indices and also the value of knowing the normal hematocrit and hemoglobin? So this is actually for grading of anemia. So for grade 1, this is defined as a hemoglobin measurement of 10 grams per DL, also known as mild anemia. Grade 2 for moderate anemia, which accounts to 7 to 10 grams of deciliter of hemoglobin. Grade 3 for severe anemia, which is a hemoglobin level of below 7 grams per deciliter. So moving on to the different classifications, we have two major types. As for the causes, it may be secondary to blood loss or any hemorrhagic conditions. Second, due to inadequate production. Third, it can be secondary to destruction. As for the morphology, based from the MCV or the mean corpuscular volume, it can be divided into three: normocytic, microcytic, or macrocytic, depending on the size of the red blood cell. So for decrease in production, this can be secondary to defective production, maybe primarily to any bone marrow pathology. For hemorrhagic conditions, it can be an acute blood loss, a bleed from a hemophilia patient. As for hemolytic anemia, after production of normal bone marrow via erythropoiesis, hemolytic causes can be of any problems within the circulation. So these are the different causes of anemia. So for decrease in production, we have chronic illnesses such as leukemia, any neoplastic disease, hypothyroidism, or liver diseases. For impaired RBC production, it can be secondary to any micronutrient deficiency such as the iron, vitamin B12, and vitamin B6, affecting erythropoiesis. Also, for increased blood loss such as hemorrhagic conditions, this can be secondary to acute or chronic bleeding such as trauma or any bleeding episodes. For increase in destruction, we have the different hemolytic causes, which may be secondary to an inherent cause of the red blood cell, may be an enzymatic defect or an abnormal hemoglobin synthesis, like in thalassemia, or maybe due to an external factor due to toxicities from drugs, poisoning, burns, or splenomegaly. As for the basis coming from morphology based on the size, it can be microcytic, macrocytic, or normocytic. For the microcytic, it occurs in iron deficiency anemia, and the value of this is usually below 80 femtoliters based from the MCV. And it may be secondary to heme synthesis defects such as in your iron deficiency anemia and your globin deficiency defect secondary to thalassemia. While for macrocytic anemia, this happens when there are abnormally large red blood cells in the blood and would measure around more than 100 femtoliters. So this happens with vitamin B12 and folic acid deficiency. For the normocytic anemia, the overall hemoglobin levels are decreased, but the red blood cell size remains to be normal. So the cells are around 80 to 100 femtoliters. This happens due to acute blood loss, hemolytic anemias, or aplastic anemias. So as healthcare professionals or allied professionals, there are certain investigations that we can look into, such as the complete blood count and diagnostics. These are actually the laboratory tests that we run to investigate further as to the cause of anemia. So we have the complete blood count. We can also investigate for the presence of stool hemoglobin, for any occult blood loss via the GI tract. We can also check for the peripheral blood smear, which I will be discussing more later. The iron levels, which is related to the transferrin ferritin, folate, and vitamin B levels as well. We can also check the functions of the liver and the kidneys to check for any problems in the rate of production because the kidneys produce the erythropoietin. And of course, lastly, if there's any doubt with the with the results of the laboratory test, we can also do bone marrow biopsy. So the red cell population is defined by quantitative and qualitative parameters, and this may be of quantitative measures such as measuring the hematocrit level or the packed cell volume with a normal value of 33 to 45%. Also, red blood cells, which measures around 3.9 to 5 million. For the qualitative factors, these are the blood indices which I already discussed, the MCV, MCH, and MCHC. While for the rate of production or the level of production in the bone marrow, we can assess this by getting the reticulocyte count. RDW, or the red cell distribution width, would also measure the variation in the volume and size of the red blood cells. So we cannot discount the importance of the value of checking the peripheral blood smear, especially for cases of anemia, since there are congenital causes and also acquired causes of anemia. So in the picture, you can see thalassemia target cells, and they are actually hypochromic cells, and the presence of target cells are actually the pathognomonic feature of this disease. Also, we have the ovalocytosis, spherocytosis, which are congenital causes of anemia, and these usually are secondary to membrane defects, and also with stomatocytosis. As for the different diseases, number one on our list is iron deficiency anemia. And this anemia is associated with either inadequate absorption or excessive loss of iron in the blood. This is the most common cause of anemia in children, and it's the most common cause of microcytic hypochromic anemia. The stages of this disease includes iron depletion, which happens when tissue stores are decreased without a change in the hematocrit or serum iron levels. Iron deficient erythropoiesis happens when the iron level drops and erythropoiesis begins to be limited. The third stage is iron deficiency anemia itself, which manifests as microcytosis and hypochromia. So we have the different causes. So we already mentioned that pregnancy is one of the major population, or the pregnant women are one of the major populations affected with iron deficiency anemia. So this happens because of insufficient iron supply during this stage, or increase in the demand of iron because of rapid growth. Also, we have blood loss, insufficient iron intake in the diet. There can also be impaired iron absorption and insufficient iron supply at birth for neonates. As for the signs and symptoms, we can detect decrease in the serum iron level in further investigations, and decrease in the hemoglobin level and the complete blood count. Other symptoms would include the patient can have pallor, cold hands and feet, shortness of breath due to hypoxia, fatigue, sore tongue, brittle nails, irritability, and dizziness. And as for the treatment, we recommend ferrous sulfate at 3 to 6 milligrams per kilogram per day, usually divided into 3 doses, and it is recommended to base it on the elemental iron content of the iron supplement that we take. We also recommend folic acid at zero point 0.4 milligrams per day, and vitamin B12 supplementation via intramuscular or subcutaneous injection. Of course, we cannot discount the importance of education, and to explain the side effects of iron therapy to the patient. Some patients can expect black stools or can manifest with constipation. And the importance of dietary intake. So how do we recommend the intake of iron? The first one is to take the iron on an empty stomach. So we should take it 1 hour before or 2 hours after a meal, and to increase the intake of vitamin C to enhance iron absorption. We can also recommend to eat foods high in fiber to minimize problems with constipation. And remember that stools will become dark in color. So also, we take note that the most reliable criterion of iron deficiency anemia is the hemoglobin response to an adequate therapeutic trial of iron, which is 1 gram per DL in 1 month. As for megaloblastic anemia, it is characterized by a deficiency of vitamin B12 or folic acid, and pernicious anemia happens when there is a decrease in the red blood cell when the body cannot properly absorb vitamin B12 from the GI tract. Vitamin B12 is necessary for the proper development of red blood cells. Since vitamin B12 aids in the production of DNA and RNA, this results in RBCs that are larger than normal and die earlier than the 120 days life expectancy. In folate deficiency, on the other hand, there is decrease in the production of RBCs due to lack of folate or lower than normal amounts of folic acid in the blood. Folic acid works along with vitamin B12 and vitamin C to help in the creation of new proteins and helps to form red blood cells and produce RNA and DNA. As for the causes, number one, in pernicious anemia due to the lack of intrinsic factor in the stomach. So this is produced in parietal cells, and this happens during or after surgery or a surgical procedure cutting most of the parts of the intestinal part of the gastric system. And then due to poor absorption of vitamin B12 in the stomach, also digestive disorders, alcohol abuse, poor dietary intake, and intestinal dysfunction. As for the signs and symptoms, the patients can have tingling or numbness of the hands and feet, muscle weakness, neurological problems such as dementia, depression, and memory loss. Also, glossitis, headache, pallor, or weight loss can also manifest. So the goal is to identify and treat the cause of the folate deficiency. And we can provide folic acid supplements orally and to advise to take in green leafy vegetables and fruits. And of course, replacement therapy in case of poor absorption by the intestines. So, as for the COVID-19 pandemic, so during an economic crisis in general, an increase in micronutrient malnutrition is not unexpected. And the availability of nutritious foods in particular is affected by COVID-19 measures. So, what are the nutritious foods? These are the animal sources of foods, the red meat, fruits, and the different leafy vegetables. And production of these foods is labor intensive, as we all know, and therefore more impacted by social distancing. These foods are more susceptible to perishing and food waste when markets are disrupted. And these foods are more expensive and the first to be dropped from the household when incomes fall. So in the graph, the yellow bar shows the consumption in the month of May, comparing it with the consumptions in January to February. Of note, a decrease in the dietary consumption, especially to the poorest of the communities. During an economic crisis, there's an increase in micronutrient malnutrition. And you can see in the graph that the livelihood and food choices are affected. The first part is there would be changes in the livelihood activities, reducing expenditure of non essential or luxury items. So we begin to sell these. And um, after this, children may drop out of school and migrate, and then eventually there would be increased use of child labor, and ultimately there would be reduced expenditures on essential items. So the last resort would be possibly health threatening activities. And as for the food choices, since this will also be affected, we would opt to cheaper, lower quality, and less preferred foods. So parents or families would tend to reduce the diversity of food, which has poor source of nutrition, and this can result to reduce or reduction of the size of the meals and the consumption of lower sources of nutritious food. And sometimes, of course, in our country, some people may beg or eat items that we don't eat before. So that's our compensation due to the economic crisis. Because of the depletion of body stores and lowered immunity, the appearance of clinical symptoms such as micronutrient deficiency or anemia may ensue, and underweight wasting may happen, and also early childhood mortality. This is the conceptual framework on how the COVID-19 would impact malnutrition. And because of the disruption of economy, our food and health system are also affected. And so this leads to hunger and food insecurity, and also difficulty in accessing nutritious foods, poverty, and inequity. So this may also result in increase in the number of infectious diseases and poor hygiene. So projected changes in consumption of nutrient-rich food show significant declines in red meat, fruits, and vegetable intake. So in the graph, you can see that there will be an increase in the number of poor people worldwide of more than 20%. And this is due to the 5% economic downturn. So as for the prevention of anemia, we encourage to eat a healthy diet. And of course, as part of prevention is to also check for the complete blood count within these ages. So at around 6 to 24 months of age, and at 2 to 6 years of age, and during the adolescent period of 10 to 19 years of age. So what are the sources and what we should eat? So iron-rich foods are red meat, liver. We can also get this from egg yolk. And also we can also look for iron-fortified cereals or meals available in the market. So we also advocate eating leafy vegetables and avoid blockers such as the tannins or tea, chocolate, and coffee, which may block 50% of iron during absorption. And also, we discourage the intake of phytates, calcium supplements, zinc, and peppermint. And we may also encourage them to take in this after 2 hours of taking in iron or before taking iron. So as summary, the function of red blood cells and the importance of knowing the normal values as medical technologists or allied health professionals or as a normal person in identifying anemia. The relevance of laboratory diagnosis and investigations, the effect of COVID-19 with anemia, and the value of preventing it. So thank you very much. I'll pass on the mic to Rachel for any questions in the chat box. Thank you.
Thank you, Dr. Nuki. And just like she said, now we have a little more time to answer your questions, which you submitted during the presentation. As a reminder, you can still submit the questions through our meeting's chat box. So, Dr. Nuki, our first question is actually from my classmate. And her question is, are you ready, Doc?
Yes.
Our first question is, what it's like to a doctor dealing with children with cancer. Since nabanggit po kanina sa opening ay sa pag-introduce po sa inyo na you are a pedia, right?
Yes,
Pediatric
that's correct.
doctor. Ayun po.
What's it like? I guess during residency, during a pediatric resident, I was very touched and very attached to my patients with chronic diseases. And that's why I've decided to go into hematology and oncology. My pre-med is also medtech. That's why the topic of hematology is really close to my heart. And during my training, I was really happy because I know that I understand up to the level of laboratory diagnosis, because as medtechs we really get to deal and get to know the basics of understanding the different laboratory tests that we do. And of course, as a doctor, it's very, in a way, inspiring, knowing that your patients would heal and would make, and knowing that you make their lives better. It's actually a very fulfilling job. Yes.
Okay, we see, Doc. And as Juan Andre Martinez asked, can anemia be hereditary?
Yes, there are a lot of anemias that can be acquired and also can be hereditary. So I suggest, if you haven't seen your complete blood count, you should do at least, like in the lecture, at least at 10 to 19 years of age during adolescent period, you should have your complete blood count and check for the MCVs. And the mean corpuscular volume, or the RBC indices, are great um, measures or evidence to know if you
Yes.
have
So
any
I suggest
anemia which is congenital. So a low MCV count would point you to a probable thalassemia or any anemia secondary to membrane defects. So I would suggest for you to get your CBC done.
That's noted, Doc. And from Mark Delvin Quero, as mentioned a while, coffee can block absorption of iron. Is there any established value as to when coffee is already harmful or can lead to anemia?
So I think, well, coffee can generally block like your phytates and your tea, and but I think for the established values, I think drinking coffee would not really trigger or result to anemia, because we take iron in the diet, and maybe there are other possible causes of anemia that will result to, the pallor, the decrease in the level of hemoglobin. So I think, for the established amount of coffee, based here from the question, I haven't really I didn't know the actual value of coffee that would result to anemia. But I think it's just a preventive measure, knowing that for a fact that iron can be blocked by your calcium and also taxane. So we should prevent, or actually we can advise these patients to take in these 2 hours after taking the meal. So after 2 hours after drinking coffee, you may take the iron already. So yeah.
Okay, thank you, Doc. And for our next question naman po is message lang po siya sa akin ng aking classmate. Bakit nagiging dark ang stool kapag nag-take ng iron supplement?
Okay. So iron is the color of iron is actually black. So it when it is disposed or part of the stool, it will uh, the color would be black. So like in any bleeding episodes, di ba, when you have your menstruation or any blood. So after a while, the color would tend to be brownish after when it gets dried or oxidized within the gastric system. So yes, the color of iron and the blood in general would turn into black.
Okay, Doc, thank you for answering that question. For the next question po, Doc, medyo marami po. Am I right? Sabi po nung nag-ask, am I right that that wrong sleeping pattern greatly affects our blood count?
What again? That?
Inask po nung classmate ko po ulit, am I right that wrong sleeping pattern greatly affects our blood count?
No, that's a wrong belief. So, anemia or iron deficiency can be addressed by proper diet. And even if you're pagpuyat tayo during exams, hindi siya nakakababa ng blood. Diba sinasabi nila, pag may mga patients na nagko-consult, parang ang baba po ng dugo ko, Dok, kasi nagpuyat po ako. Hindi totoo yun. So, ang possible, feeling lang nila yon. Pero hindi. It's more of diet. Hindi totoo na dahil puyat ka, pwede kang magkaroon ng anemia or bumaba yung level ng dugo. It's more on the diet or any deficiencies.
Oh, I see. So, hindi naman po ibig sabihin na hindi dahil sa ay hindi naapektuhan ng sleeping pattern ang ating blood count or ang cause ng anemia, hindi naman po ibig sabihin na pwede na po tayong magpuyat tama. Iba pa rin po yung makakuha tayo ng tamang tulog and of course, makakuha ng highly nutritious foods. Right, Doc?
Yes,
Great.
agree. Thank
So,
you.
for our next question, is thalassemia dangerous?
Thalassemia, depending on the inheritance. So, we have the major, the minor, and the trait. So it depends if you got both of the genes from your parents. It can manifest as a transfusion dependent type, wherein you cannot maintain your blood at more than 9 to 10 grams per DL. And at this level, you need regular transfusions to address the anemia. Because of the abnormality in your globin chain synthesis, this would be detected as like a foreign substance in the body, and this will be acted upon by your spleen. So this results in splenomegaly, and more red blood cells are destroyed in the system. Hence, anemia will be severe for these cases. But if you only have trait or the thalassemia minor, then the manifestation is lighter. So it depends on the genetic um, inheritance of the patient. So generally, it's not fatal, but it depends on the severity of the disease of the patient.
I see. Okay, Doc. Dito naman po sa ating chat box, in-ask ni Sir Rex, is overproduction of hemoglobin be fatal and what treatment should be recommended? Hemoglobin po.
Is is it right? Is iron deficiency fatal? Is
Is
that the
the
question?
overproduction
Okay.
of hemoglobin po can be fatal
Okay,
and its
okay,
treatment po if ever.
okay. For overproduction, it can contribute to like making your blood thicker. So it can predispose you to episodes such as blood viscosity, and if you're in the age group like yung mga nasa old age na, pwede siya maging predisposition to episodes of strokes since pagpangit yung blood flow natin, if there's like inadequate hydration or cases with abnormalities in the blood vessels, then we can be predisposed to episodes of stroke.
Okay, Doc. Our next question naman po is asked by Miss Carly. Heavy period po ba can be dangerous to anemic patients?
Heavy period. I think I've actually encountered this when I was in high school. I had irregularities in the pattern of menstruation. And mafe-feel mo na kapag nandun ka na sa anemic episode na sobrang lakas, fatigue and weakness, you'll feel that, and eventually you'll see that you'll be having pale skin or hands. And so the first sign would be fatigue, and then dapat makapagpa-check ka ng CBC. And if the evidence or the complete blood count would show a low level of hemoglobin, then iron supplementation is maybe indicated. And kapag iron deficient naman yung person, mag-respond yun agad with iron. Even for 1 week of supplementation, then there would be a profound increase in the hemoglobin level. Okay. So
I
it's actually not fatal, but it can be addressed immediately.
I see, Doc. So, kailangan talaga na magpa-lab test, di ba? When in doubt, right?
Yes.
Okay. So, another question from Miss Carly. Can patient with mild anemia still donate blood? And are anemic patients recommended to reduce physical activities? Ito naman po, may cases na ng anemia yung patient.
Actually, before we donate blood in our blood banks, there are a set of requirements. And if you're anemic, I know they differ for you to donate blood. So it depends on the laboratory, but in general, it's not, I think, recommended for you to donate if you're already anemic. And then the second question was,
If can patients with ay, if are anemic patients recommended to reduce their physical activities?
oh, I think it depends on the person and the level of comfort that he or she has, especially if he or she is already experiencing fatigue or weakness. So, and it's like a sign of hypoxia already. So I wouldn't recommend personally.
So thank you, Doc, for the recommendation. And from Gabriel, what is the success rate if you have acute myeloid leukemia or AML?
Okay, so leukemia is the most common cancer in children, and it accounts to like more than 70% of cancers in childhood. And for acute leukemia, you have the most common, the acute lymphoblastic leukemia and the acute myelogenous leukemia. So for ALL, it accounts to like more than 80% of the acute leukemia cases. And for AML, that's around 10 to 20% of the acute leukemias. And for AML, unfortunately, we really have a poor success rate with regards to the treatment of these cases as compared to patients with acute lymphoblastic leukemia, where we encounter 80 to 90% chances of survival. So out of 10 patients, you have like 8 to 9 patients who will be cured. And for the acute myeloid leukemia, once na diagnose sila, it depends also on the acute myeloid or myelogenous leukemia. You have different types. So we have 0 to 7. And the good prognosis or the good one is the acute promyelogenous leukemia. So we have the different types. So the success rate would depend on the type of AML and also the different factors like the genetic mutation that can be detected via your cytogenetic testing. So it will depend on the genetic mutation of the patient and also the type of AML because we have different types. But in general, if we're talking about the yung mga not APML, it's less than 50%.
Okay, Doc.
Oh, there's another question.
Yes po. There's a lot of questions po. May nagme-message din po sa akin. And yung question naman po ni Janina or Janina, good day po, Doc. What can you advise to those who could only afford buying instant food, canned goods, or instant noodles in preventing anemia? And kasabay po nito yung may nag-message din po sa akin na since nutritious foods are hardly accessible During the community quarantine, especially for the poorest of the poor, what could be the possible alternatives for individuals to reach their daily micronutrient requirements since some of them nga po couldn't afford most highly nutritious foods? Ayun daw.
Okay, so because of the pandemic, we have difficulties in accessing nutritious foods, and of course, this would lead to different deficiencies. So, I think as a Filipino citizen, parang we can really relate to them, no? Parang ang hirap rin ng ganitong pandemic. So, aside from, of course, we need the aid of the government, but I cannot really talk about, para in general about that. What I can recommend is, of course, to uh, still go for foods that can give iron. So, ano ba yun? Siyempre, yung mga simple, yung mga red meat, and green leafy vegetables, and yung mga may iron fortified foods. And also, meron din tayong iron supplements, syrup or tablets that can also be taken by these patients or individuals. But kasi food pa lang, dapat doon natin kasi makukuha yung iron from food. So parang ang hirap maghanap ng cheaper alternatives. Pero ang meron lang naman talaga is to get the iron-rich foods that we have. So, that's it.
Okay, Doc. Thank you for your advice, Doc. Ano ba, Doc? For Mark, Doc, when do we consider IV or intravenous iron therapy, or how many cycles of oral iron before we will consider IV iron therapy?
Okay, so if we're talking about iron deficiency anemia, usually with oral supplementation, it will be suffice depending on the we still need to compute based on the weight, but for IV iron therapy, we recommend this to patients who cannot tolerate oral iron supplementation. And second, also, we can give this depending on the level of deficiency of iron. There's actually a computation. We can give this once a week and to achieve our target of normalization of hemoglobin. So I think one of the indication would be if the patient cannot tolerate oral iron supplementation, because we recommend like to take iron supplements 3 times a day or 3 tablets a day, and some patients would have GI upset, constipation, and if they become very irritable with this treatment, some would resort to having IV iron infusion.
Okay, Doc. From our chat box again, before po ako mag-proceed sa Q&A panel, is there a disease or illness that can be mistaken as for anemia from Shena Marie de Borde? Para mang false
Disease that
anemia
can be
po.
false anemia, maybe any disease that could manifest as pallor. So if there's any episodes of hypoxia, but also if the patient would claim to have fatigue or weakness, then this can be secondary to a lot of diseases. But anemia is one consideration if the patient would feel a lot of times tired, and of course the color of the skin, and one also if the patient has splenomegaly. So one consideration would also be anemia.
Okay, Doc. And then sa Q&A panel naman po natin, meron palang mga questions na sinend dito. Um, Hello po, may relation po ba ang blood type and anemia?
Oh, blood type and anemia. So actually, I haven't crossed anything anemia in relation if you're blood type A or B or O. So I think the blood type is not actually a great factor uh, for anemia.
Okay, noted doc, wala po sa blood type. Okay, may isa pa po from our chat box. Ferrous sulfate po ba should only be taken with a doctor's prescription?
I think even if there's no prescription, taking iron supplements you can take that for me in general, but don't make it more than 3 months because it will already be toxic in the blood. Iron is also toxic to the endocrine organs and to the heart and the liver, and taking more than 3 months of iron is actually not very often or not recommended. So you may take it, but not more than 3 months.
Okay, but not more than 3 months. Okay? Magbabasa lang po ako ng mga nakalimutan kong basahin kanina. From an anonymous attendee. Hello, Doc. Please enlighten us on the pathophysiology of leukemia. If okay lang, Doc.
Leukemia. So there are the for leukemia, it's multifactorial. Number one is genetics. And there are a lot of genetic abnormalities that can be detected by by our cytogenetics, and also environmental. So, di ba, they say exposure to radiation and other factors can also be a cause. And I think one important thing to know is the family history. So, acquiring leukemia is multifactorial. You cannot really say that this is secondary to one cause.
Okay. Most people mistakenly known anemia as the first stage of leukemia daw po, Doc. Is this true daw po ba? That the anemia is the first stage of leukemia.
Well, leukemia can manifest as anemia because in leukemia, there is impaired in the normal production of the different cells in the bone marrow. But from what I can recall, no, other symptoms would be bone pains and febrile episodes. Others would have palpable lymph nodes. So not only anemia, but there are a lot of constellations of signs and symptoms usually prior to the detection of leukemia.
Okay. Our next question naman po is from Rap. Will low iron level in blood can save from COVID-19?
Will low iron level of blood?
Yes po. If yung iron level daw po ba is mababa sa dugo, indications po ba yun na ligtas sila sa COVID-19?
Mm, I think there are no studies about it, or I haven't crossed any study about that. But I think if you have low iron, then that's a marker of a micronutrient deficiency, and we don't want this in times of infection or any diseases because this can it may be predispose you to more severe form of the disease.
Okay. Okay, Doc. So, from COVID-19, relation to COVID-19, balik po tayo sa iron supplements. Ano daw po ang indications kung kailan po mag-take ng iron supplements?
So at times we recommend this taking iron supplements during increase in demand. So yung pag growing kid or at around 6 months to 1 year of age, and during the adolescent period, just to supplement and reinforce for any increase in the demand of iron during these stages. So we can take it actually naman yung mga over the counter iron kahit around 1 tablet per day, just not more than like 3 to 6 months of taking it kasi it's going to be toxic. And you know that iron is recycled in the body, and we shed around 1 milligram of iron per day, and the rest are recycled.
Okay, Doc. About sa pag-administer naman po ng ferrous sulfate, ano po kaya ang mga side effects nito?
So the things that I've encountered from patients, they usually complain of constipation and GI upset. So we have different forms of iron. We have the ferrous gluconate, which is at times we can recommend, aside from ferrous sulfate, we can give patients ferrous gluconate, which is more palatable or absorbable. But with these different forms of iron salts, they contain lesser amounts of elemental iron, which is more important. So for ferrous sulfate, they contain 65 milligrams of elemental iron per tablet, 60 to 65. And then for the ferrous gluconate, it contains around 30 to 35 milligrams of the elemental iron. So it will be more absorbable, but and less side effects because of the different form, but you will require more amounts to take in to address any deficiencies in the body.
Okay, Doc. So before we proceed to our final question, i-ask ko muna po yung most asked question for today is if could anemia exacerbate COVID-19 infection?
Because COVID-19 would ultimately affect probably a hypoxia or oxygenation, because this is a respiratory tract infection, then I think yes, anemia can aggravate the symptoms of COVID-19 as an infection. And the healthier individuals are less to have the symptoms of the disease, and of course the people who have more deficiencies, they are the ones who are predisposed to having severe or the severe form of the infection.
Okay, Doc. So before we proceed to our last question, may another question from Sir Dino. It is observed that O type of individuals are comparatively resistant to anemia in spite of large frequency distribution of O groups in general population, whereas anemia is relatively prone to the individuals having blood group B, A, or AB. But the reason for this is not stated. Do you happen to know the reason why po?
Well, we happen to know the reason for that. I think uh, the explanation for this is, well, I think I haven't really read about it, but for the different blood types in general, anemia, if you have the normal nutrition, and if you have if you don't have any diseases that comes with it, still will have a normal hemoglobin level, and the blood type doesn't really matter with the development of anemia in general.
Okay, Doc. So for my second to the last question po, what are the causes of hemophilia and its treatment?
For hemophilia, there are two types. It can be acquired or it can be inherited. And this is an usually an X-linked disease affecting men. And the manifestation would be bleeding in the bones or spontaneous bleeding on the mucosal area. So what are the causes? It can be genetic via X-linked, and it can also be acquired if the person will have antibodies against factor 8. So the most Common forms of your hemophilia are the hemophilia A and B, which are deficiencies with your factor 8 and factor 9. And for the treatment, factor concentrate is the most effective treatment for hemophilia. We have factor 8 and factor 9 concentrates available. And also, we can transfuse cryoprecipitate, which is rich in factor 8, but it depends on the weight of the patient, on how many we can transfuse. And I think what is more important in hemophilia is the severity. So it depends on the level of factor 8 that the person still has in the body for you to be able to address more the concerns, not really for the bleeding, but also holistically, knowing that these patients would isolate themselves, would tend to not go out and mingle with other people just to prevent any possible trauma to cause bleeding. So that's it.
Okay, Doc. Thank you for that information. And now naman po, for our final question, it's actually from a classmate because I am a fourth year medical technology student po. So this is his question po. Good day. As a graduating medical technology student who wants to be a doctor and a pediatric oncologist in the future, may maia-advise po ba kayo on how to get there from here as a student po?
Nice question. Um, First one is when you get into med school, know for a fact that you will sacrifice a lot in terms of social life, and maybe some of your friends from high school will not be very visible. And of course, being very consistent. I think that's one of the most important thing that I would recommend is kahit na tinatamad ka na because ang dami mo nang inaaral and all, just be consistent and just keep the end in mind. Kung ano yung gusto mong ma-achieve. So, yun yung dapat na lagi mong nasa isip. And when you get into internships, it's possible na ma-feel mo baka mamaya hindi pala to for you. Ma-feel mo during your rotations in the different departments if um, either adult or pediatric or surgical yung magiging love mo. And eventually, since if you are a med tech, mas maganda yung understanding mo with dealing with blood or other diseases addressed in the laboratory. So I encourage you to just be consistent, be diligent, and understand what's happening. And matagal siya. Parang it took me more than 15 years just to graduate with this subspecialty. And kailangan ma-meet mo yung demands. The sleepless nights, studying, and of course, sacrificing family time. So, but in the end, I think it's very rewarding because I get to share my knowledge. I get to go to different countries and explore and share what I know. So, it's rewarding in the end. Thank you.
Okay, Doc. Okay, so thank you, Doctora, and thank you everyone for actively participating in our Q&A session. There's actually some questions left, but sadly, due to time constraint, we can no longer entertain some of them. But you can always reach us through the MTSOC and IS official Facebook accounts. But before we end our event, we would like to express our appreciation for Doctora Nuki by presenting to her the simple yet meaningful certificate. Let's just wait. It reads Far Eastern University Institute of Arts and Sciences awards this certificate of appreciation to Paula Bianca E. Nuki, MD. for her valuable and unselfish contribution as a guest speaker in the 2-hour webinar entitled Anemia, the Diagnosis, Prevention, and Impact of the COVID-19 Pandemic on 30th October 2020, organized by the Department of Medical Technology, Far Eastern University, Manila, via Zoom. Okay? This
Thank you
activity
very
pala,
much.
okay po. This activity pala is a part of the IS-based virtual activities supporting education. Now, everyone kindly turn on your cameras for photo op with our speaker. Sir Benny, please take the lead for taking our screenshots po.
Okay, may we request everyone to turn on their cameras just for a short while? Okay, waiting. Okay, smile. One, two, three. One
Sir,
more.
complete muna natin yung panel kasi madami yan. There are about 100 people in the room. So let's complete that. I think we'll have 4 or 5 panels. Let's complete that. Everyone there still opening their cameras.
Okay, I'll
Okay.
proceed to the next panel. Okay, so one, two, smile. Okay, okay. Um, Yan, okay. I think it's ano din. Okay na po din na yun na po yung mga nag-on ng camera. Thank you
All
everyone.
right. Okay.
Thank you, Sir Benny. And now, I would now like to call on Miss Laarni Hannah C. Lacorte, one of our assistant program heads of the Department of Medical Technology, to give us the closing remarks.
Thank you, Rachel. Can you hear me, Rachel?
Medyo nagbo-buffer po.
Okay na?
Yan po. Yes, clear na ma'am.
Okay. Okay, so thank you to our dear speaker, Dr. Paula Biancanuti. Thank you, everyone, for spending your afternoon with us. I hope we have learned a lot about anemia, which is a public health concern. We learned something about red blood cells, the causes and types of anemia, how to diagnose, what are the possible treatments, how to prevent anemia, and of course, the impact of COVID-19 pandemic in this type of blood disorder that greatly affects not just adults, but children as well. Numbers of children are greatly affected by this pandemic. There's an increase in micronutrient malnutrition due to economic crisis. It has affected most programs during community quarantine and, of course, the availability of nutritious foods. We must keep in mind to eat healthy, such as iron-rich food, in able to prevent anemia. So let us keep our body and mind healthy in this time of pandemic. So finally, in behalf of the Institute of Arts and Sciences and the Medical Technology Department, I would like to express our appreciation to our dean, the organizers, and of course, the participants for making this webinar possible. Thank you again and enjoy the rest of your afternoon.
Thank you, Ms. Lacorte. And if ever you have any other questions, please reach us through our official Facebook accounts mentioned earlier. But before you leave today's webinar, you will see the link of the evaluation form in our chat box, including a short survey on the presentation, and we would appreciate if you would complete that and provide your feedback. E-certificates will be issued to your registered email around 2 to 3 working days. Once again, thank you so much, Dr. Ranuki, for making time with us today. Even though you're busy, you still made a way to educate and impart to us your expertise. Okay, everyone? Let's all give her a warm round of virtual applause. Okay? And of course, thank you guys for attending and participating till the end of our webinar entitled Anemia, the Diagnosis, Prevention, and Impact of the COVID-19 Pandemic. Goodbye, everyone, and we hope to see you again next time. May you keep safe always. God bless you.